24.
Okay, so if you wouldn't mind giving me, so we're gonna be an hour.
Yeah, good.
Yeah, and Brian, if you could give me 20 minutes
Okay.
and then 10
Okay.
and then 5.
So I'll do 20, 10, and 5. I'll do 10.
Oh,
Use both
yeah.
hands.
Okay, that's I'm an older guy. Maybe I ought to go to the restroom first.
Yeah, do it.
Okay, I don't want to hop up during the,
That's
have to take a leak.
Yeah, let's make sure we're not live yet.
yeah. No, we
Come on.
Yeah, Jim, go left.
Yeah, I know.
Okay, I was gonna go where the dog was.
Well, that's good. You had a good conversation with that.
Yeah, she'll be with us starting on Saturday. Sunday. I was like, she's like, should I talk to Grace? I'm like, no. No, if you do, I would need you to just move. I was just saying that Jim's going to the restroom.
Oh.
I didn't want him to go that way and
Oh, okay.
get the dog all worked up.
I mean, leaving for that dog. Ready?
Yes, can you grab? I know I totally tried. Don't I look?
No, you
like that?
can on. That's
Um,
no.
Could I have my phone out of my butt?
She'll be kind of like, doctrinaire. But I haven't seen her, talk to her in decades, but in those days she was like, really. I remember, she had a booth, at the front of the student union with this guy. And Danny O'Neill. It's one of the O'Neill brothers, you know, the union O'Neill
Oh,
guys.
yeah.
Danny had the bad hand. He was a biker.
Yay.
Danny went over and jumped one of them, started yelling, and then he got in a fist fight with the guy. Danny. So he almost got kicked out of school. He was the SDS guy at San Jose State. Danny O'Neill.
Who's this?
We were talking about Martha O'Connell and Roy Heath at San Jose State, and Danny O'Neill getting in a fight in front of the student union.
You ready?
Ready to go.
All right,
Yes.
I kind of sit up a little second. Up here like this. You said it's like right like this.
Well, thank you all very much for joining us this evening for our mental health town hall with Jim Beall, with Senator Beall and former Supervisor Beall and former council member Jim Beall, and a lot of other titles that we could give him. And one of the reasons I'm so honored, frankly, to have your support for the mayor's race is that you have such a broad portfolio. You've done work on everything from transportation to to serving the disability community, to behavioral health and mental health, and helping us with the hospital. And I'm just very grateful for all your service.
Thank you. Thank you. I'm grateful for your service also.
Thanks, Jim. So tonight, what we're going to be talking a little bit more about is behavioral health. And one of the reasons that we're talking about that is I know it's a big issue for all of us in this community. And I know that it's becoming even more prevalent and more people are starting to address it. And I know that one of the big bodies of work that you've addressed, and also a former Senator John Vasconcellos back in the day, was very worried about how we dealt with the stigma of mental health. And I think you've done so much work on that we're just really excited about. And one other thing I'll just mention is that counties are the level of government that does work both on behalf of the state and the federal government, and making sure that we're spending those dollars in the appropriate way, particularly around these issues on behavioral health and drug and alcohol counseling and the like. And so we're going to dig in a little bit to that. And I know that so many of you who are watching are very interested in this topic. So if we need to do another one because it's so meaty, let us know. But I want to start with you to say, that while you were on the Board of Supervisors, one of the big areas that distinguished Santa Clara County was how much money and how many resources the county actually invested in behavioral health, really mental health, before most states were even thinking about it, or most counties. Could you just talk a little bit about what inspired you?
Well, I think it was all the board members. I don't like to take credit for everything, but we had Blanc Alvarado, we had Zoloff, and then the other board members who were all basically saying that when the state back in the Reagan administration cut down and closed the hospitals, and then we had a lot of people move into the downtown area and other areas as a result of that without care. The state didn't fund the care. We felt that to make our community safer, we need to step up and try to do best we could, even though it generally wasn't our total responsibility, but we stepped up and invested more money than other counties did in mental health. So we set the tone. We were considered the gold standard. And I think we still are, by the way, in terms of investing local general fund monies into mental health programs and substance abuse programs.
And I think you raised such a good point about how at a local level, we ended up responding to statewide changes that were so dramatic and so many people. And I think even with the closing of Agnews, that you saw more and more people who are very high need in less than appropriate care than we would like to see at a local level. I will just say to all of you that the county spends a little over $600 million a year investing in mental health. We'll talk a little bit about the services that the county provides. But one of the important points I wanted to raise is that a lot of that resource is money that we generate locally from our property taxes, and in part because we don't get quite as much money from the state and federal government. Now I'm excited, I think, what you can talk a little bit more about. But let me start with and dig into the first technical question. That while you were on the in the California State Senate, that you offered a bill, SB 803, which allows Medi-Cal funds to be used for peer support services for individuals struggling with mental health issues and addiction. And I wanted to ask you to talk just a little bit about the inspiration of the bill and why it's so important for us at a local level.
Well, we saw a lot of veterans come back from Vietnam in the time that they closed the state hospitals. And the VA started to have these veterans help veterans programs. They weren't necessarily professionals in the mental health areas, but they would be supportive, almost like a 12-step for veterans, but a little different than that. And what they did is they developed this program for peer support. They had a buddy system. And we looked at that and we found that other states have already did this. It wasn't like we were inventing something new. And so we introduced this bill and it took us 3 times. We had to introduce it. It was vetoed twice.
Wow.
But the third time, Governor Newsom, who's really been the first governor in 4 or 5 that actually worked on mental health issues, to be honest about it. He signed the bill, and we now have a program that we're just starting.
Well, what's really exciting about this is that it also kind of addresses another issue, which is that we have such a tight labor market that finding clinicians is really difficult. And any of us who've tried to find a clinician for ourselves, a family member, a friend, knows that it's a big waiting game. It can take really a long time, and people often want services right away. And I'm wondering if you see this as a way to close that gap so that people can get services sooner.
It is part of the network that we need to have. We need to have different levels. We need to have these kind of boots on the ground people, the peers that work in the community, that work with people's. Dolores Huerta supported the bill. She actually called the governor in the middle of the night, I guess. I heard it's a famous story, but that's what she does. And they have a program with the immigrant community of Promotores, and that's sort of what it is. It's sort of like having other mothers, other people that speak the language, that have some kind of relationship with the person, to be a peer support and be trained, have a training program and get certified. That was what our bill did. It certified people. So they would have some training and able to help people, but they still need the network of counselors, psychiatrists, psychologists. The network has to be built up. And I think that's the next step with the workforce program that the state just started this last year.
Yes, I'm very excited about that. And I'll just share with our audience that, one of the issues that we recognize is that pipeline problem is very, very real. And I think the more rich the network is, the point you're raising, the better off we're going to be, because it doesn't mean that the whole system rests on psychiatrists or on clinicians or on social workers, because if it does, we're never going to get to the amount of services that people need.
Yeah, they're just people have to realize that people with mental health problems or issues, they need help immediately. They can't be waiting around if the appointment's in 3 months, for example, which in some cases it is in some systems. Even when you have insurance, it takes a while to get an appointment. And I think those people that don't get an appointment just get worse. It's like any other illness, they get worse. And when they get worse, maybe they'll lose their job. And if their insurance is at their job, then they end up in the public health system that has to care for them. So that's the county. And I think the system doesn't work right now. I mean, they say that only less than half the people get adequate mental health services in California.
I'm sure that's true. And, we've got to keep at a local level, working with the state, working with federal government, working with our education partners to build that pipeline. And I'll also say the thing I really appreciated about your bill is that by funding this through Medi-Cal, the opportunity it gives us is to make sure that people get the treatment they need, and we can do it in a sustainable way. If it's not insured, it then becomes very, very difficult to do.
Yeah, the financing is the name of the game with mental health because essentially Medi-Cal and funding it through Medi-Cal, but also private insurance has to be the way to fund these things. Private insurance often resist bills like the parity, mental health parity bills. They always oppose them. I did it 4 times. I lost 4 times. I 0 and 4. But we finally got a parity bill last year that we co-authored with Senator Weiner, and it's kind of a parity bill.
We're getting closer.
We're getting closer, step by step, to
What
getting
bill was
treatment.
that?
It was SB 855 that I was the principal co-author with Senator Weiner in 2020. The last year I was in office. So we struggled. It was very hard in the midst of COVID to get the bill passed. And COVID has only made things worse. The astounding increase in mental health problems in California and the United States, all over the world actually, because of COVID, suicides, all those things are up, substance abuse, just general anxiety. It's even with, especially with children, it's astounding looking at the numbers with kids. So we're having this explosion of mental health issues.
I think that's right. And that's partly why, your leadership at a Senate level will be missed. I know that Senator Cortese is leaning in on these issues as well. But you've become such an expert here on them.
I'm not going away.
That's right. So you also authored SB 11 and SB 29,
Yeah.
which improved mental health de-escalation training for peace officers in order to reduce the violent confrontations with people suffering from mental illness. And I was wondering if you could just talk a little bit about the bill, how it will work, how do local communities access the resource, and how do we know if it's successful?
Yeah, the first bill, the SB, I keep getting them mixed up, but SB 10, I believe, was the bill for the police academy. So when somebody goes into a police academy, they're under the peace officer training laws, required to have a certain amount of training in different categories. Our bill put the category of mental health training into the law, that they have to have mental health training on recognizing. We found that most of the police chiefs supported this. Our police chief supported it in San Jose. The law enforcement organizations all supported it, except for the sheriffs. Sheriffs did not support it because they didn't want to be told what to do, I guess. The second bill was for field training. And that was to train like the sergeants, the people that are already police officers. So the first bill was to train the ones that are going to be police officers. The second bill, the ones that already are police officers, so we can have the complete force trained in mental health, understanding people with autism, developmental disabilities, and we also put in the bill cultural competency, which is very important to understand different cultures, how people react. And so that's part of the training also. And it's been very successful. It's changed a lot of law enforcement attitudes towards training and mental health issues.
I think that one thing that folks are really recognizing is that we send police often when we don't need to send a police officer necessarily. And I wonder if, as part of the training, do you see that it's helping us think more about sending the right skill set to the right call for service?
Yeah, I think so. I think the city of Memphis was the first city to do crisis intervention teams, where they send a specialized training unit that was trained on mental health crisis intervention. And when they had a call that was determined to be more of a mental health issue. And that has been very successful. Seattle did this. Major cities across the country have done this. Our city has trained our officers in these crisis intervention, de-escalation training, all those kinds of issues. Our police force is pretty well trained, San Jose. I know we're much better trained than the sheriff's department or many other law enforcement agencies. And I think that this was widely accepted by the police to have this additional training. In fact, we're now having correctional officers in the prisons, even firefighters, other people that want this kind of training also.
It's interesting that you mentioned firefighting because we did a town hall with them, and one of the things that I was really struck by was the number of responses that they have, because a lot of what they're doing obviously is medical, and really taking a look at not just the training, but what are the other services that we can provide. And so, for example, here, I'll just share a few things and would love to get your thoughts on them. So we have a psychiatric emergency response team. It's called PERT. And this team is really our most, it's our most intensive level of services that we can send out. And so it's a combination of social workers and law enforcement officers. And it really is intended for a crisis situation that's at a very high level. We're working on this now in South County and in Palo Alto. It's still a bit of a pilot, and we're learning how to use it. And the main way that they get called is really through 911. But we also have a mobile crisis response team, and this is a program that the county and the city of San Jose have been partnering on. It actually took a while because we were waiting for the city to train up the officers so that we could pair them with clinicians. And this is called our mobile crisis response team. We call it MCAT. And that team, there's a particular phone number, or now, because we have 988,
Yes.
we're really expanding.
Yay.
I know, this is really exciting.
Worked on that for 10 years.
And now
We
here
got
it is. Yeah. And so we'll talk a little bit about that next. And then we have mobile response stabilization services. And these are really for youth under the age of 21. And so if you have a young person that's in crisis, you're able to dial again 988 and get screened, and then they will help you determine whether or not it should be a mobile crisis response team or the suicide hotline, or you need service navigation. And then the other that is very new for us, and your point is that other states have been doing this for a while, is the trusted response urgent support team. And this is really goes back to the point you raised earlier about peer that our battery on our camera died, and so we're innovating. So thank you for hanging in with us. And that last group is let me just go back, is trusted response urgent support team.
Right.
So to go back to your point about 988, this is really critical. And maybe since you were one of the leaders on this, you can talk about the innovation, and I'll talk about how it's being applied here in Santa Clara County.
Well, the governor in the budget, he actually funded 988. So that was the big victory. So now we'll have money go to handle all the calls. So a lot of people, well, you can have these people called, and what's going to happen? Well, they funded a response, and the calls will be answered, and there will be a response team. And that's what you're talking about, getting a response team. And we're so happy that the whole system was established. So that will result in less confrontations with regular police officers. The other police officers don't like to deal with these issues. They feel like, well, they're the most strong supporters of 988, the police officers themselves.
Absolutely.
They love to see this adopted.
And it's relatively new. So it began in late summer, maybe late spring, early summer. And for us, some of the services that we're bringing online, we're bringing them on relatively quickly as we can. But as an example, I think what Jim just said that's so important is that for us, it's going to give us a way to triage calls, and then to, 911 can communicate with 988, 988 can communicate with 911. so that we really are getting the right response to the right call.
Right.
And I think for officers, one of the things that's really critical is in San Jose, since we have so few officers, that getting them to be able to, have the support they need, to have alternative supports to be able to respond to people in need, I think is going to make, I hope will increase response times, in addition to us needing to hire more officers that are trained, as Senator Bell is suggesting. So I think this is really exciting.
Governor did a great job. He pulled it together this time.
And
Keep it up, Governor.
so for those of you who really care about these issues, this would be a time to send your letter that just says thank you and please do more. One other thing I'll just add is that we at 988, so in addition, when you call that number, if you could also call that number and it's not an emergency, and ask to just to understand resources better. And this is particularly important for families and friends that may have somebody who's in crisis.
Right.
And they don't exactly know how to address it. They may not be in crisis in that moment, but you may be curious about, what does their insurance allow for? What kinds of services might they need? What are some strategies to getting them the services they need? And so a portion of what we're doing is we also have these navigators that are going to be able to help people make appointments or help them strategize about a family member. And again, this is all relatively new, and we're going to learn with all of you while we're doing this. And what we really want is to make it possible to get people the services they need as quickly as we can.
Yeah, and I'm my wife Pat and I are supporters and active in NAMI, which is the families that have people that have mental health issues, like my family does. And we've gone through the family to family training, which is the link the families need to have to learn about these systems and to understand what they can do if there's a crisis in their family. And I urge people to get involved in that. It's a short 6-week class you can take, free, funded by NAMI. The volunteers come in and they train you, other family members. And we continue to talk to each other in our class about what's going on with our family member, our loved one.
And I would say that for the county, NAMI, the National Alliance for the Mentally Ill, has been a huge inspiration for a lot of the work that we're doing around peer mentoring and peer education. And we're using that even as people come out of being incarcerated. We're connecting them with peer mentors and peer support as we try to get them stabilized. And we are also doing family finding, which I know is
Very important.
It really is. And so by that family finding, it means that if there's a caring family member that still has the resources and the energy and all of that, because sometimes bridges have been burned after a while, then we're wanting to connect them. And again, I would just say NAMI's been a huge, I would say a huge inspiration, at least for the way we're thinking about the work at the county.
And I think NAMI has all the languages, cultures, they have classes for that group, LGBTQ, other kinds of groups that people can get involved in. It's a volunteer group. We have thousands of people in the organization in Santa Clara County.
We really do. It's a great group. So as we talk about mental health, I think for a very long time, and I want to say this was back, 10, 20, 30 years ago, people thought of mental health over here and drug and alcohol issues over here. And maybe you could talk just a little bit about how you started to understand they were connected and what you moved the county toward.
Well, we had a drug and alcohol department and a mental health department at the county and at the state. And what they tended to do now is to merge them, because everybody realizes that drug abuse and substance abuse and addiction is a health problem, just like mental health is a health problem. And we need to treat them together. We need to treat them at the same time. A lot of comorbidity happens where you have mental health, you have maybe you have some brain damage, developmental, or you might have some physical illness, diabetes, and a substance abuse problem. There are treatments, addiction medicine doctors that specialize in addiction. And we have, of course, psychologists, psychiatrists that can also prescribe new medications. There's a lot of new stuff in treating somebody with a mental health problem and a substance abuse problem. The last thing I like to say is this. A lot of it starts when they're teenagers or preteen. And we see the jump in the kids with feeling sad, depressed, all that, and they turn to medication, which is substance abuse. And so it's early intervention, early treatment, having support systems in the schools. All those kinds of programs are very important right now because we're seeing this anxiety level of the kids go up due to COVID. It's just jumping like crazy all over the United States. So this is a very important issue.
I do think the point you're raising about how do we talk to parents and kids at a younger and the most appropriate age is really something that we still struggle with at the county. One of the things that we're working on right now is an education program around fentanyl.
Yes.
And the reason is that kids are able to order fentanyl online, access it and not know. I mean, they'll think they're getting a Percocet or some other kind of pill, and lo and behold, it's got a toxic amount of fentanyl that could just kill them. And we've seen a huge rise in that. And so we are doing a program now at the county to make Narcan available at schools. We're really going to be focusing next on colleges and other places that young people are. But I wonder if you could talk about the Drug and Alcohol Committee you started at the legislature and how the committee thinks about prevention.
You know, when I started it, everybody was like, "Oh, you can't do anything about this problem." You know, nobody wants to deal with this because it's why waste your time here in the legislature, Jim. I said, no, I'm coming from the county and I see that it's one of the biggest problems. Then, you know what I did? I went to I visited 24 prisons and jails all over California. I mean, when other legislators were going to Hawaii and on trips, I was going to Pleasant Valley State Prison for the mentally insane, you know. So I was visiting all these prisons all over the state. And I talked to the warden, I talked to the inmates, I talked to the guards, staff, and the doctors there. And I find that the commonality was child abuse when they were young, sexual abuse in the women. I've been to the women prison in Chowchilla twice, drug abuse, and mental health problems that were untreated. And that's why we're spending $120,000 a year for each inmate in the state prison. In the juvenile facilities, $300,000. In Pleasant Valley, the psychiatric facility in Atrascadero, $350,000 per inmate per year. So is there something we can do from a humane standpoint, but also from a financial standpoint that would be a better model, a better way? And there really is, is to have full treatment available, full mental health services available. It would save the taxpayers tons of money if we did that. And that's why the county's not going to be able to do it, or the city, but there has to be mayors that advocate for a full service wraparound type services available throughout the state without the limits that we put on it right now, because we're putting too much limits on it, and then people fail and they recidivate and they come back and they go around like a hamster cage, round and round and round through the system, and it ends up costing a lot of money. So I learned that by going to the prisons, basically, Cindy. I talked to people and I talked to the wardens. They would say, you know, half the people shouldn't be here, Jim. They should be in the drug treatment program. Or these women, they were accessory to a crime, not the person that committed the crime. And they were just in it because they were using drugs. And if we can have good drug treatment, guess what? Crime rate would go down. Schools would have better graduation rates. Less county social services through the foster care, child welfare would go down. All those things would get better. Save money. The economy would get better. It's proven that if we had good drug treatment in employers, you had full drug treatment for everybody. less absenteeism,
Mhm.
less employee coming to work, not really prepared to do their job. How many people have had an employee that had substance abuse problems? Quite a few. California, probably about 1 million people right now, they have substance abuse problems.
Exactly.
It's we got to have a full service system in California. The mayor could be, I know it, Mayor Steinberg in Sacramento is fighting for this, and
Mhm.
Mayor Garcetti was fighting for this.
Yes, and
Two mayors I'll point out that really supported this.
that's really
Mayor Faulconer, the Republican in San Diego, was a strong supporter.
oh, that's really good. to
Yeah,
know.
so we had like it's not a partisan issue.
Yeah.
We have like a wide span of support for this, but the mayors have to be the ones that go to the governor and say, Governor, we need this. We need a full service mental health, and we need full service substance abuse treatment programs.
I think you raised a really good point, Jim. And one thing that I feel like that's happened a lot here in our county is that there isn't a full understanding, I think, between the city and the county over all the different opportunities there are to support each other, to bring down the kind of resources it's going to take to address these issues.
Big problem is you got to work together.
That's exactly right. And so the county right now, we, like I said, we're investing quite a lot. And in some areas where we need the opportunity to invest more, I'm very interested in the state and federal government and giving us resources back that we're paying in taxes that I'd like to see come back to our region, particularly as it relates to the high need and acute and subacute care that we know people need. And I think the point you raised about being able to get services on demand is really critical, because I think most of us, and if you're watching and this hasn't been your experience, and you would be rare, which I think most of us have somebody in our family, or we personally have had a drug or alcohol problem or a mental health problem. And what I observed is that when people are ready to get help, they're ready right then. And we don't necessarily have enough beds, and then there's paperwork that can take days and days and days, instead of really being able to opt into the kind of services we need. And one of the challenges that I found is that the state, I believe, in some respects has felt, I think this maybe before Governor Newsom, that the local governments didn't need any more resources to be able to address this problem. And
Oh, you're right. I think you're right. That's correct.
And I don't think that for a lot
It's
of
not our responsibility, so let the local governments do it.
right. And the problem with that is, whose job is it? And my thinking is it's all of our responsibility, right? And I'll just give you an example. The county, when I and Dave were both on the board, decided to support the cities in getting housing built. And I remember that, and as you know, cities permit housing, cities work with the state and federal government to subsidize housing. But what we saw was that the cities didn't have the support they needed to build the housing that they needed. And we also saw that we were providing a lot of drug and alcohol counseling and services for people living on the street. And it wasn't very effective because they didn't have a place to live and there was no way to stabilize them. So we got, with your leadership and the help of many, we put Measure A on the ballot and started to build more affordable housing. And one of the things that leaders at the county told me at the time is they said, oh, no, we don't want to be in the housing business, because if we are, then everybody's going to blame us for the homelessness problem. And my feeling was, and I know this is the way that you lead as well, is that whatever level of government has the capacity to help has an obligation to do so, as long as we do it in a really transparent and collaborative way. And the way I look at where we are now is that we're just starting to see the fruits of our labor on the Measure A housing. We've got 1,000 units occupied. We've got almost 1,000. We have 2,400 people housed just from that slice. Now we're housing people in shared housing. We're housing people in naturally affordable housing. We're housing people in below market rate units. We're doing all of that. But I say that because as it relates to people who are really high need, it's so expensive to serve them. And we really need the help of the state.
Well, they need to, Cindy, create different levels of care. Some people can live in a housing project with supportive services. Some people, that's not going to work. They got more problems. They need to be in a nursing facility or a psychiatric facility
With more services.
with full services. And that's why we changed CalAIM to get those programs funded, are eligible for funding now. And we have to get the federal government to loosen up their rules about preventing funding using Medicare and Medi-Cal for psychiatric facilities.
Can you say more about how CalAIM can help now?
Well, CalAIM now allows you to use some of the money in terms of programs, in terms of the healthcare and services, and it now allows you to include housing.
Mhm.
So you can include finding a place for somebody to live as part of their care that they need. Because quite frankly, you can't really care, and it's not really therapeutic to be homeless, right?
Right.
So,
Right.
anxiety and all that makes it worse. But if they have a stable living situation with good care, good wraparound, full service program, that model is the most successful model in terms of getting them to moderate their mental health problems, maybe solving their drug abuse problems. Some drug abuse problems require medication. Usually the more serious drugs require medication, like methamphetamine or opioid addiction requires medication, medical assisted treatment. But we need to combine it all into a package for the person based on their needs.
I think that's a really, really good point, that, that it's so challenging for any one level of government even to be able to afford it, which is partly why I would like to get more of our resources back, because I think what that will help with
That's
is,
what the mayor does, Cindy.
I know, I'm
You're
looking
gonna have
forward
a
to
big
it.
job for you to do that.
And I think partnering with the
Yeah,
county,
yeah.
because I think what happens is the counties go together and then the mayors go together,
Yeah.
and that's, that's not productive. It's not helpful.
No,
And, we saw a lot more success when they were collaborating together. With, like, for example, during COVID. Oh, thank you. Thank you very much. I was hoping if we could, let's talk a little bit about disabilities, if you don't
Okay,
mind.
okay.
I know this is an area that you've been playing a leadership role in.
yeah,
And I want to tell you, one thing I'm very excited about is we're starting an Office of Disability Affairs at the county.
oh,
And
good.
we had over 70 people help participate in developing the language. And now they're going through a planning process right now to design the office, because one of the things we found during COVID is, as appropriate and sensitive as we thought we weren't. And
Okay.
so we're working with the community and they reminded me nothing about us without us. And so they're all
Yeah,
at the
that's the
table
way they
right
say it,
now. But I wondered if you could talk a little bit about the bill that got approved. It's $300 million to shore up California's commitment to people with developmental disabilities. And if you could talk just a little bit about that bill.
That was more of a budget bill because that was money. And it was for a long time, the programs for developmentally disabled were at the tail end. And when they had some serious budget cutbacks, they made cuts. And as a result, a lot of the operators of homes for developmentally disabled closed. And they had to find places for people. They would double up homes and it became overcrowded. They weren't getting paid. The staff wasn't getting paid enough. So I just went to the legislature and pounded the doors of all the members. You have to go and talk to 120 people. And I convinced the legislature to fund the appropriate amount for the need in California, because we were having an increase. And you know where it was coming from? Autism, severe autism. There were kids with severe autism. It was blossoming in California. This area has a lot of autistic kids, our area particularly. So the hardest thing was this real tough guy. He was a real conservative fiscal guy. His name was Jerry Brown. And I went to Jerry and I said, Governor, you need to fund this. If you don't fund this, you're going to remember this for the rest of your life. There are going to be people that are not going to have happy lives. The whole purpose of the law is to take care of those that can't take care of themselves. you need to take care of this. And he said, no, he's, I'm not, we don't have the money, Jim. And then so finally about 2 or 3 days later, he called me up and he said, all right, we got the money.
Good job, Jim.
So you need to fight as an underdog. And I've lost a lot of battles on the mental health, developmental disability, and substance abuse. I've lost a lot of battles. And a lot of people say, well, was it worth it? And I said, yeah, because what happens was I lose and I lose and I keep introducing the bills and I lose. And then finally, even if somebody else introduces the bill, they will win. And that's what makes me feel real good, because somebody kept it up, kept the persistence up and didn't give up and were successful. Because sometimes you have to fight, especially for the hard ones. In that way, it's mental health's real tough. You have to fight hard.
And Jim, do you think the reason for that is that nobody thinks it's their job, or what do you think that is?
Okay, I'll be honest with you. I think the state, when they closed the hospitals, they didn't realize how much it would cost the state budget to provide care in the community. And then in 91, I think they did what they call realignment program agreement with the counties. And it was during a budget crisis. They said, well, we're going to give you some money. We're only going to give you X amount of money. And that's going to be it. So we're going to give you this amount of dollar amount. And then in 2011, we had another budget problem. They did the same thing on realignment. They put, we're going to give you this much money. And if you need more money, it's up to you. So they kind of like almost sort of wash their hands of the growth of caseload, the growth of cost, and that presented a real problem in terms of the budget. And 2011 was when, about 25–30% of the state budget was cut because of the economy going down and revenues. And when they cut the people that can't fight hard for the money, and mental health, developmental disabilities, alcohol and drug. The alcohol and drug programs in the prisons got wiped out. We had to rebuild them from scratch and fight for it, because they said, well, we just funded prison guards. We don't fund any of these alcohol drug programs and counseling programs. And a lot of that got cut. So the system since about 2010 has been rebuilding itself. It still needs to be rebuilding, okay? There were some very bad cuts in those days, very bad, because the budget of the state had to be, the revenues, state has to balance the budget when they approve the budget, revenues, expenditures. Revenues went down like $30–40 million, billion dollars, and it was terrible. It was a terrible, Governor Schwarzenegger was there. And we barely hung on until Governor Brown came in, and then he slowly increased it. He did a pretty good job, but I think he didn't really recognize the need until Newsom started to recognize the need. Newsom. So we had the last 4 governors that really, they kind of like, well, that's the counties. And then the budget office, that's exactly, they never support any bills on mental health that involve money. Read the veto letters today that came out from the governor when he vetoed the school mental health bill. Sharon Quirk Silva, it's in the governor's website today. It's actually was vetoed.
That's unfortunate.
Senator Portantino's bill got vetoed also. They're all mental health bills.
When we go back and think about the disabled community here, with our office of, our new Office of Disability Affairs.
That'd be great.
Yeah, I'm really excited about it. And I'll just say to all of you who helped us, thank you. And if you want to get more involved in it, just shoot us an email, and you can do it to my office, or the campaign will get you connected to the right place. But I say this because one of the things that I have been really struck by is a number of families that have a family member that has a mild to severe disability.
Yeah.
And how difficult it is for them to get services. And I wonder if you could talk just a little bit about the regional centers and like where they are in that pipeline, and how counties and cities could work with them.
Well, the regional center is okay, when we created the Latterman Act, it's called, it wasn't created in a normal, creating a State Department way. What it was they created 21 regional centers operated as nonprofits, and they contract with the State Department of Developmental Services to provide services for about 400,000 people that have developmental disabilities before they're 18 years old. Okay, so if your family member, loved one was developed disabled from birth or later, before they were 18, they would qualify under the Ladder services. They can't take care of themselves. They're at a lower level and they're not able to care for themselves. So they need to have care. Well, the state gave the responsibility to the regional centers to accomplish that and provide the services so that each person has a case worker. And they created what they call a circle of support. These are volunteers that they have meetings with the person that's developmentally disabled. And they create a service plan, an individual plan for each person. And each person will have a plan, and each person will be able to say, they'll just say, like, what would you like to do? What would you like to have in your life? What would make you, would you like to go to school? Would you like to have a job? What kind of health problems do you feel that you have? Are you feeling sad? And a lot of people that have developmental disabilities can't really articulate, are you a victim of crime? They don't, they hardly ever are prosecuted for somebody that commits a crime against somebody that's developmentally disabled because they can't describe what happened to them, for example. I know this for a fact in my own family. So I think the circle of support, creating an interested group of people, and it could be a school person, a pastor from a church. By the way, in the mental health and substance abuse, we have to have the religious community get involved, stay involved. They have been involved, they've been great. There's a lot of churches they're helping. We want to continue that. I support that entirely. People have to have hope. That's part of the cure. Hope is part of the cure, we say. So I think for somebody with a child that has developmental disability, 75% divorce rate in the family. 75%. So we have to have a support system for those families. And it's hard to raise a child that has a developmental disability.
Yeah, and I'll say that my colleagues on the board, and I really appreciated the support of Supervisor Ellenberg and Supervisor Lee on this item, and Supervisor Simidian and Wasserman. Supervisor Simidian really brought to our attention focusing a little bit more on making housing available for the disabled. Right. So the county has really been investing quite a lot of resources in both housing for different affordability strata and also for services. But the housing for the disabled, it's really kind of striking to me the number of families that have keep their family members living with them.
Yes.
But in anticipation of death, and we have
getting older.
We have parents who are really asking us to make sure that there's a safe, secure place for their loved one long into the future. And I wonder if you've ever seen any bills that could be helpful to us in terms of funding housing.
Well, they have Senator Portantino has been picking up the charge on some of these things. They have had bills that have funding using state developmental disabilities funds to fund, to match, like a local government that wants to build supportive housing for people of developmental disabilities. They have to have a special model for that kind of housing. In other words, if you have somebody that's developmentally disabled, they may be able to live independently or sort of semi-independently if they have like a social worker in a housing project where there's like 6 or 7 people living there, or in our case, 4 people living together with full 24/7 staff.
Mhm.
that is in the house, but we have to have support for those. Some of our operators are public, some are private, some are nonprofits.
Mhm.
We have to support those operators that want to do that want to operate those kinds of housing units.
Well,
And
and
fund
we-
them. fund them.
right, and we also have, I'll
Sure.
just point out, those that are medically fragile that are living in group homes now.
They're more expensive to have somebody that's medically fragile.
Yeah, and there's not, I mean, I will just say again, I think this was, as all the institutions finally close their doors, this idea that it would be feasible or possible or easy to keep folks in the community. It's a great vision, but it's been incredibly hard to achieve. And I think we've seen the challenges at a local level.
There's a lot of people that have a theory, but they don't know how to make it work in practice.
Right.
That's one of the cases of developmental disabilities, housing or mental health housing. It's a great theory for them to work and live in the community and heal and participate. It's a great thought. I agree with that, but let's talk about the pragmatic reality of how to do it.
Right. And I will say that, on the housing front, as it relates to people who have serious mental illness and those kinds of challenges, we are finding that for the very, very seriously mentally ill, that having services attached is keeping people housed.
Right.
And so that's been really, I think, good. I think the challenge is that the longer people are out on the street, the more they decompensate. And I think the point you raised that was just really important is, what do we do to keep that from happening in the first place? And, one of my thoughts has been that really looking at the prevention end and the rapid rehousing, along with continuing to house people, is the only way to go. But the federal and state government, getting their help on actually creating the right level of service for folks who are relatively high need and someday could be stepped down, but right now they really can't be. And I'm a little, I'm concerned that promise hasn't been fulfilled, right? That we were gonna, and it was many governors ago, right?
Right.
So I don't know if that
We
means,
haven't had a governor concerned about this till the current one. And he needs to be more concerned about it, believe me.
okay, well, we'll make sure we ask people to help us with that. I just wanted to close on a kind of a broad, maybe a kind of a broad question for you. I know also that you've been a champion for the disabled. You've been a champion for the elders. You've been a champion for really for so many communities. But I'm wondering if you see, you said Senator Portantino.
Yeah, there's other people. Yeah.
I'm
he's
curious
one
who
of them.
you see that we should be thinking about working with, and
Yeah.
if there are mayors you've seen in other places that you say, okay, this is our team. This is where we can go.
Well, the worst mayors, to be honest about it, are the ones that say, we only do this at the city and we don't do any other things. We're doing the core services. I've heard that here in our city by a mayor from our city.
Mhm.
I don't like that kind of talk because that shows a lack of understanding of how to solve problems. It's like not solving problems. How are you going to solve the homeless problem unless you have all levels of government get involved in it? You can't just put people in prison.
Mhm.
Remember I said it's going to cost money? Okay, by the way, prisons have 100% funded with the general fund. You can't use federal funds to fund a prison. But if you put somebody in a drug treatment program, you get at least half the funds from the federal government.
Mhm.
That's an example. Somebody, think you have to think smart. You have to think how to do it. And you have to think how to pay for it. And you need people to understand all these different layers of government. The layers maybe shouldn't be there. I wish we had just, an easy, simple system, that everybody gets care, but we don't have that now. So I think we need mayors that understand that. That's why I'm supporting you, Cindy. I think you understand, you get this. I mean, you're gonna be frustrated too. It's gonna be very difficult. It's very difficult. It probably is difficult now for you.
Yeah, I was gonna say I'm
But-
frustrated
but-
now.
But these people that come up with the easy solutions,
Yeah.
put them in prison. That's an easy solution. Okay, well, you're gonna put them in prisons. We're not gonna have colleges because back 10 years ago, the budgets for the prisons rose so fast, it passed up the budget for the UC and the CSU system. Is that really what you want? I don't think so. think people want colleges and education. So I think thinking out solutions and being pragmatic and making it work rather than just talking and, I can do a survey and find out what the issues are and put that in my brochure or whatever. I see a lot of that, puff pieces. Doesn't work. You have to spend the time to understand it. I brought you a couple of books. You want to have these books? This is Dr. Insel.
Yeah.
Dr. Insel has been he's been the main advisor to the governor on mental health issues recently.
Oh, that's good.
Really had a great impact on governor, and he's also had a great impact on President Obama and President Biden, because he was the head of the National Institute of Health, and now is here in Silicon Valley. And his book he just wrote a book called Healing. It's about how to solve the mental health problem in a comprehensive way. Dr. Insel, he's up here in Mountain View right now. And this book is the other side, the prison side. It's the book Bad. It's about a guy that was in prison and why he was in prison. He wrote that before he passed away, and it's by James Carr. And it's a San Jose family. And it's his autobiography about why he ended up like he was being honest. Here's why I ended up like how I was. And I want to write this book because, I want people to think differently in a creative way and have a sense of urgency, because there's so many people that we need to help right now. And we have to have a sense of urgency. We can't just read the speeches, and go to the press conference. We have to function in a way where we're actually solving things. Exactly. And working with all the different levels of governments. And so that's those are inspirational books to me.
Thank you.
One from a more spiritual side, and one from just a guy that knows how to solve problems, Dr. Insel.
Well, so first of all, thank you so much. And
Keep 'em.
thank you. I appreciate that. And one thing I'll say about Dr. Insel that I thought, I got a chance to hear him speak. And one of the things that I thought was so powerful is he just sort of says, it's broken. And this is sort of Susan Ellenberg's,
right.
It's broken. And we all know it's broken. And I think at a local level, what we've been working really, really hard to do is that even though it's broken, just knitting it together with gum and popsicle sticks. And I think, one of the opportunities we have right now is that there is a focus on this, and this is an opportunity to create great reform. And again, I would just say if the city and the county could actually work together in a much more thoughtful, dynamic way, that I think it would encourage cities and counties across the state to do the same thing. Because I think us going and lobbying for one thing and not another, and cities are fighting for housing money, counties are fighting for mental health money, we should be fighting together for all of it, and to get the resources back into our community so that we can respond at a local level. So I'm
You
really
got it, Cindy. You got it.
I totally appreciate it. And I appreciate you spending time with me. And I know this is an important topic to our community. Thank you for all
You're welcome.
the work you've done really for generations, and a great debt is owed to you.
I'm continuing to do it. I'm a member of the board of Palo Alto University now. So I'm working on getting young people through college and their degrees in psychology. So I'm continuing to work on that. I'm helping San Jose State with student internship, scholarship programs like stuff.
Excellent. Of course you would.
Yeah, of course.
Thank you all very, very
Go
much
Spartans.
for joining us. That's right. Go Spartans. You've got two alum here. Everybody have a great night. Thank you for joining us.